COVID pandemic has shaken up the world. Some have been lucky enough not to be infected by it, and some have suffered immensely, whether it's our family, friends, or loved ones. Apart from people, businesses world over have been severely impacted. Hospitality, airlines, the travel and leisure industry. Perhaps no other business have been more impacted by COVID than the cruise ship industry, of which we're all an integral part. But there's a glimmer of hope. Our industry has been slowly but surely battling all odds to rise up. Our beautiful ships, our crew, our guests will return, and how. We're seeing light at the end of the tunnel, and this is a good thing. All thanks to the COVID vaccine and the vaccination program, which are being offered by governments across the world. Good evening, I'm Rakesh Nair from Carnival Support Services India, and I welcome you all to today's webinar, which focuses on one thing and one thing only: seafarers' welfare during COVID-19 and cruising again. I'm delighted to introduce the panelists for today's session, starting with Etna Williamson, Vice President of People Services in Carnival UK, Dr. Brenda Barnettson, MD, Senior Doctor Clinical and Group Health Services for Carnival Corporation and PLC, Dr. Rashna Dadrawala, Company Doctor for Carnival Support Services India, and finally, Prasad Hariharan, Managing Director, Carnival Support Services India Private Limited. I welcome you all and thank you very much for taking some time off today to be a part of today's webinar. Over the past week, we sent across a survey to all crew administered by CSSI across all brands and asked them if they would like us to ask any questions. We received an overwhelming reply. Over 2,000 crew responded with 3,500 questions. We have taken a selection of these questions, and I would like to start by asking our first question to Etna Williamson. Etna, good evening.
Good evening.
What measures of safety and protection are in place for our guests and crew on board our ships?
Thank you, Rakesh, and I'll answer that in just a moment. I would like to start with a sincere apology to everyone for the delays for today. We had some technical challenges, unfortunately. There had been various tests that did happen, but unfortunately things went awry. Challenges is definitely something that we're all facing at the moment. So apologies again for the fact that there's been a delay, but hopefully we've not lost too many of you and you get to enjoy this webinar. So Rakesh, going back to the question that you asked. So we've a situation where we have many safety measures in place, both for crew and for our guests. And as part of your joining instructions, you'll receive information on how to support your preparation, your travel and life on board. In the meantime, please be careful and remember hands, face, space. So your hands, wash your hands regularly, soap and water, minimum 20 seconds. Use your alcohol hand-based gel where soap and water is not available, and remember to avoid touching your eyes, nose and mouth. Face, wear that face mask, but ensure that the face mask is properly worn. It needs to cover the nose and mouth, and a medical face mask is recommended. And space, please keep your distance. Try and ensure that you've got a 2-meter distance from others. But where you can't do this, then minimize your interactions to less than 15 minutes and make sure that everybody's wearing a face mask. It's so important that you all look after yourselves and those close to you. Thank you, Rakesh.
Thanks, Etna. My next question is vaccination compulsory now for all our guests who join?
So that actually varies by ship and by brand. So for some it will be, but it's not across all of Carnival Corporation. So will depend.
Okay. So we've been hearing reports that there are some COVID testing facilities on board ships. So will there be any COVID testing facility on board our ships?
So yes, to support our crew and our guests, they're going to be testing. So, and actually the safety and well-being of both crew and guests obviously paramount. So there's testing for our crew pre-travel, also pre-boarding, and then once on board.
Great, thank you. And so, lot of countries are now opening up their vaccination programs to all adults. So our crew, if they were to get vaccinated, under a government scheme, will they get reimbursed on board?
So the key on everything here, and you'll hear this, I'm sure, a few times today, is get your vaccination as soon as you can. This is in the interest of your health and your safety and the health and safety of those around you. Through the vaccination centres of the central government and some state governments, vaccines are free of cost. But if the only way for you to obtain the vaccine is through a paid-for process, and where possible, we will pay that directly, but where it's not, then hold on to your receipts and you'll be reimbursed once on board.
I'm sure that the crew will receive this information very favorably. Thank you so much. So will crew be able to get vaccinated on board? So for any reason, if they're not able to get vaccinated prior to joining a ship, will they be able to get vaccinated on board?
So at this time, it varies by brand and by ship. We're working with governments and states around the world to support the vaccination of our crew and team on board. So, and there's a number of programs already in place. But please reiterate again, get the vaccination at your earliest opportunity. Don't rely on it being done once you get on board. Apologies, but we are working on making that available as well.
Great, thanks. So would you recommend that crew complete their vaccination dosage, even if it means rescheduling their joining dates?
So, again, get the vaccinations as soon as you can. At the moment, there's a point where we're working on the situation of, where possible, getting both vaccines before you board. Brilliant, because we know that you've got that full protection in place. But we understand that vaccine availability is limited, both in India and in the home nations of our other team members. So, we have got crew joining who aren't fully vaccinated at this time, but please get the opportunity, get your first dose, get your second dose if you can. And then for some, we will be adjusting the scheduling, and for others, we will look to be able to support that vaccination on board.
Great. Thank you, Edna. That was very insightful. Thank you so much.
Thank you.
My next question is for Prasad. So Prasad, what compliances do crew need to achieve? They need to get back on board.
So the compliance specific to your assignment, you will get to know in your joining instructions that you will get. But there are certain compliances that are mandatory for all seafarers, like STCW certifications. Your passport needs to be valid. Your CDC, if you have one, needs to be a valid document. And if you can get an SID, apply for an SID, please go ahead and do this. Now, I say this because you must get your STCW courses renewed whenever it is expiring. Unless you have a valid STCW courses, however much we try and find a position for you on board, we will have to sort of cancel that assignment purely because your STCW is not valid. So my emphasis is use this time. If your STCW certificates, your passports are nearing expiry, please go out there and renew them.
Great, thanks. So what about the US visa? We have crew who have asked us whether they can renew the visas, even if they don't have a joining date.
So the US consulate insists that whoever wants to apply for a renewal of a visa should have a joining date. So we have to first assign you and then provide you with a letter if you require a renewal of a visa. Okay, so that's something which we will do in the process of onboarding. So please bear with us until we find a position for you, and any support that you need for renewing your visa, we will provide it from the CSSI team.
Great. So what I'm hearing, Prasad, is the compliances which are completely dependent on the crew, which are the passports and the STCW courses, they need to get them done. And the medicals and the US visa, which will be instructed by our CSI office closer to the joining date.
That's correct. I mean, these are some of these things that we are talking about, the STCW certificates, the passports. These are, if you want to call it, tools of our trade. You know, when you're not busy, what generally tradesmen do is they sharpen their tools. So this is the time to sharpen your tools, get all the compliances in order, which are completely under your control, and then get ready. As soon as we have an assignment for you, the team will get in touch and you should be on your way. Thank you.
So recently, CSI has started a campaign to encourage crew to apply for the Seaman's Identity Document. Can you tell us a little bit more about this Seaman's Identity Document?
So Seaman's Identity Document is an ILO approved document under ILO 185. And this is carries a biometric of the seafarers as well. So the DG Shipping started accepting applications for SIDs some 2 years back or a little bit more than that. And this requires you to go on the DG Shipping portal and apply for an SID. In fact, the CSSI team has shared a how-to video with all our crew. So please use this. Get yourself an SID. Some countries are now insisting that crew have SIDs. The CDCs are not valid in some countries. Thankfully, the countries that we send our crew to, they don't have that particular mandatory requirement at the moment, but the world is changing. So when you have the time, get your SIDs done and be ready. Thank you.
Great, thank you. So thanks a lot, Prasad. My next question is for Dr. Rashna. Dr. Rashna, can you tell us a little bit about the vaccines which are currently available in India?
Currently, there are just 2 vaccines available in India, the indigenous Covaxin and the Covishield, which is produced in India under license from AstraZeneca. We are waiting for a clearance for other vaccines such as the Moderna, the Pfizer and the JJ vaccine.
And we've also heard reports about the Sputnik vaccine.
And the Sputnik also, yes.
Okay, thank you so much.
But we are waiting for clearance.
Great. So who's eligible for vaccination here in India?
From the 1st of May, it is going to be all adults above the age of 18.
So, so before the 1st of May, who were able to get vaccinated?
45 years and above were able to get vaccinated.
Okay. Okay. Can you tell us a little bit about the dosage of these vaccines? I mean, we hear that these are 2-dose vaccines, and are the intervals between the doses uniform, yes, both these vaccines?
No, both the vaccines are 2-dose vaccines. Covaxin has a dose interval of 4 to 6 weeks, while Covishield has it for 6 to 12 weeks.
Right. And, so if I want to get myself vaccinated, I mean, consider myself just over 18 years. And if I want to get myself vaccinated, how do I do it?
You can approach any government hospital or health center. You can also approach private hospitals that have been given the mandate to give the vaccines. A third option is for seamen is the Mumbai Port Trust Hospital, which is in Vadala, Eastern Mumbai. That too will be giving vaccines from the 1st of May.
Okay. And do I need to, is there an online registration somewhere? Do I need to get myself registered?
The only way to get the vaccine is through registration beforehand on the CoWIN app. So you can either go directly to the CoWIN app or go through the Arogya Setu app. Okay.
All right. Okay. Thank you so much, Dr. Rashna. So in your opinion, should crew get vaccinated? And, are these vaccines safe?
Absolutely. The crew should get, if you have the opportunity, please do not let it go. You must get vaccinated, and the vaccines are safe.
Okay, and why do you say that crew have to get vaccinated? Why, in your opinion, why is this vaccination very important?
In my opinion, even though the vaccine may not prevent you from getting infected with the COVID disease, what it will do is decrease the severity of the disease. You might have milder symptoms after taking the vaccine, and definitely the morbidity and the mortality is far, far less. It will make you less sick. It might stop hospitalization, and it is believed that mortality, death is very low in those who have been vaccinated.
Right. And, if crew were to take these vaccinations, are there any side effects to these vaccinations? And if there are any side effects, how does one overcome those?
Yes, some do get side effects. These side effects are because the vaccine is supposed to stimulate the immune system, and stimulation of the immune system sometimes results in fever. It might also result in body ache, a feeling of lethargy. In Covaxin, people also complain of feeling excessively sleepy. This lasts for a maximum of 48 hours and not more.
And are there any medicines that you need to take to overcome these effects?
Paracetamol.
Okay.
Paracetamol taken about 3 times a day should help with the body ache as well as the fever.
Okay, great. So, there are other vaccines which crew may take in the course of their, journey with us. So like yellow fever is one vaccine that they may take. And during their medicals, their PEMI, they may also take MMR or typhoid. So how safe is this vaccine, the COVID vaccine? I mean, can you take it in conjunction with the other vaccines, or should there be a time period that one needs to adhere to?
It is advisable to have a gap of 14 days between different vaccines. This is advisable but not mandatory, especially in an emergency. For example, if somebody needs to take an anti-tetanus or an anti-rabies shot after a dog bite, then it does not matter the time gap between the vaccines. However, for other purposes, it is advisable to have a 14-day gap. So if somebody needs to get vaccinated as well as get their medicals done, where they would be taking other vaccines, it is advisable to take the first dose and consider it as day 1. Then on day 14 or 15, one can go for their PEMI and take whatever other vaccines they are advised. And day 28 onwards, that's 14 days after the PEMI, they can take the second dose of the Covaxin, of the COVID vaccine.
Okay, so a 14 days gap between the first dose and the second dose is what you're advising?
14-day gap between the first dose and other vaccines. Okay, and a 28 gap between the 2 doses. Yes.
Yes, great. Thanks. We've been hearing reports that people still get COVID after the vaccine. Is that possible that you may, contract COVID even after taking the vaccine?
Yes, it is possible that you get COVID even after taking the vaccine, because the vaccine has never claimed to prevent COVID. What the vaccine does is decrease the intensity of the illness.
Right. So, what would you recommend? What would you recommend to our crew? Should they, after taking the vaccine, they would still need to follow all the COVID protocols?
They need to follow all the COVID protocols. That is, mask, use the sanitizers, and continue with social distancing. Keep a distance of at least 2 meters.
Okay. One of the very interesting questions that we received from our crew is, can one get COVID because of the vaccine?
No, it is not possible to get COVID because of the vaccine, because the vaccine is inactivated. The virus in the vaccine or the virus DNA is inactivated. And to get the disease, one needs live virus. So the vaccine cannot give you COVID.
Okay, great. And, can a PCR test become positive because of vaccine?
Again, for the same reason, no, the PCR test cannot be positive because of the vaccine. The PCR test tests live virus and the live virus load and its DNA. And that is not possible with the vaccine.
Great. In a RT-PCR report, we often see a CT level, and we often have crew ask us, what exactly is a CT level? So can you tell us something about the CT level? Doctor?
The CT level is the cycle threshold. The number pertains to the number of cycles that the test goes through in a machine to get the level of virus to be seen. The higher the viral load in the swab sample, the fewer the cycles. And therefore, the CT level on your report would be low, less than 35. If the viral load is low, then there are more cycles required and the CT level number on your report would be high. Now, one thing that very many people worry about is that the CT level, the low number says that you're seriously ill, but that is not the case. The CT numbers are in a RT-PCR test that is positive is only indicative that the low CT level is indicative of a high viral dose and an active disease. But if the CT level is very high, it means the viral load in the sample is low and the person is recovering from the disease, even though the RT-PCR may still be positive. And in India, an RT-PCR of less than 35 is considered active disease and higher than 35 is a recovering patient.
Thank you very much, Doctor. So to summarize, we need to ensure that our group get vaccinated when they have a chance, preferably to take both these doses in India before they join the ship. And after taking the vaccine, still follow all the COVID protocol measures, which is wearing of masks, using of sanitizers, and maintaining social distance. Is there anything else you would like to add, Dr. Rachna?
In conclusion, all I can add is that whether you are vaccinated or not, for your own safety and the safety of your family, don't forget hands and face. Hands regularly sanitized. Your face, keep the lower part of your face covered with a mask, include nose. The nose must be covered by the mask. And where space is concerned, social distancing, keep a distance of at least 2 meters.
Great. Thank you so much.
Try and not travel in very crowded public transport.
Great. Thank you so much, Dr. Rachna, for your insights. The next question I have is for Dr. Brenda. So, Dr. Brenda, we hear in the news reports about blood clots, that happen due to the vaccine. Can you tell us a little bit more about that?
Yes, good morning, everyone. And thank you so much for the opportunity to speak with you. I think I've met some of you through some of our fleet calls if you work on any of the HA Group brands. So to jump right in and answer the question, Rakesh, this is a good question. It's important as individuals that are living in the COVID pandemic that we have access to information and that we know how to interpret that information. So some of you may have seen on the news that some vaccines were temporarily paused because the researchers picked up that some individuals have been getting these vaccines, but only a handful developed blood clots. And so what happens if this happens when a vaccine or any new medicine is put out for emergency use for the first time? It's very closely monitored. And if anybody has side effects, then the vaccine is paused so that that information can be analyzed. And part of that analysis just simply means, what is this? How common is this? Who's getting these clots? Is this something that warrants us stopping the vaccine, or do we just need to educate doctors and patients about the side effect? And then we can resume giving the vaccine. So what's happened with a couple of vaccines is when side effects are picked up, the vaccine is paused, the analysis is done, and then the vaccine is resumed, either with some new information about precautions or just simply information. And this is the completely normal process that is followed anywhere in the world with any new medication. And basically it results what you would read in a patient information leaflet, you know, the piece of paper that you get in any box of medicine. Side effects are listed, and it's also listed whether side effects are rare or not. Now, the blood clots that have been seen with some vaccines are extremely rare. Your chances of getting these blood clots because of a vaccine are far, far less than you getting those blood clots if you actually got COVID. So when you are infected, if you get infected with COVID, there is a chance that you can get blood clots as well. And I think people forget this. And so if you are concerned about getting blood clots, my advice would really be, well, then you should definitely get vaccinated, because your chances of getting blood clots from COVID are greater than actually getting the blood clots from the vaccine. So I would suggest that you follow the manufacturers and the local health authorities' guidance on which vaccines are approved within your population and within the country that you're living in. And in this case, the vaccines that are being administered in India have been approved in spite of extremely rare side effects. And I should also say that doctors have been educated to pick up if anybody does have symptoms that would suggest these side effects, and they are completely treatable.
Great. Thank you so much, Dr. Brenda. So is there a company mandated vaccine? Is there any specific vaccine that our crew need to take?
No, our company just simply wants you to access the vaccine that's available to you in your country, and that has been approved by your local health authorities. So if you work on a brand or in a region where a specific vaccine is mandated or certain vaccines are not acceptable, we will let you know. But as of today, the vaccines that are available to crew in India are completely acceptable to company.
Great, thank you so much. So let's say, I'm a crew member and I have a joining date soon, and my medicals are running out and I wish to do my medicals as well. So how can I schedule my vaccination and the medicals, so that I ensure that I am compliant with the company's policies?
Yeah, I think Dr. Rashna answered that question already in terms of perhaps scheduling your vaccine. You should get vaccinated as soon as possible. That's really the bottom line. With a number of cases still on the rise in India, and the risk of contracting COVID, even if today you are somebody that's young and otherwise healthy, you might live with somebody or come in contact with somebody that's older or has certain underlying medical conditions that if they had to catch it from you, they would get very sick. And so we really want to try and encourage you, if you have access to a vaccine, get the vaccine. If you have a medical schedule, then you need to have other vaccines during that medical, as Dr. Rashna said. Try to schedule that medical 2 weeks after you received your COVID vaccine, if you can get a COVID vaccine.
Right, thanks. One of the questions that we received from our crew concerns the US FDA not approving the AstraZeneca vaccines. Now, as you know, the AstraZeneca vaccine is one of the approved vaccines here in India. And the concern here is that if they were to take the AstraZeneca vaccine and if they join a ship, which means that they need to join in the US, it may not be approved. Is that something that the crew should be concerned about?
Well, the CDC have said that any vaccine that's approved by the FDA or the WHO will be acceptable for crew and guests on ships in the US. So again, the central message is get the vaccine that's available to you. And if at some stage a different vaccine is mandated, then we'll work around that. But the bottom line is the CDC hasn't not approved the AstraZeneca vaccine. They simply haven't approved it yet, or they're going through the necessary steps that the FDA feel are necessary for that vaccine specifically. So I would encourage you to get the AstraZeneca vaccine. It is approved by the WHO, and that seems to be acceptable to the CDC.
Great. Thank you, Dr. Brenda. Because our crew need to travel a long distance by flights, is there any particular risk of COVID contraction if they were to take a flight?
Well, I think everybody just needs to realize COVID is everywhere, and you're at risk if you are in close contact with people. And by close contact, I mean basically within 6 feet or 2 meters. So on a flight, if you follow the recommendations of the airline and the guidelines that we give you in your pre-travel health advisory, you can significantly reduce your chances of catching COVID while you're traveling. And by that, we mean that you need to wear your mask properly, and you need to wear it all the time. And you need to be really serious about this. Healthcare workers, for example, are in close contact with people with COVID every day, and they effectively protected because of masks and because of good hand hygiene and all the measures that are in place today that are unrelated to vaccines, but all the measures that are in place today that protect people from contracting COVID-19. So yes, there is a chance that you can get affected, but by wearing the mask properly and by practicing good hand hygiene, and where you can physically distance from people while you're traveling, and that includes just gathering in airports or even using transport to get to the airport, where you can try and maintain that physical distance of at least 2 meters. But wear your mask and wear your mask properly. So when you're wearing your mask properly, it's properly covering your nose. There are no gaps on the side here. You can actually twist and tuck the little ear loops of the mask to make sure or minimize gaps on your face. So we would encourage you to do that. And if you do have access to a mask that is stronger, or the types of masks that are called N95 or K95 masks, then we would encourage you to wear those.
Great. Thank you so much, Dr. Brenda, for your insights. My next question, and I think this is a final question here, is for Prasad. We've got a lot of queries from crew, because not many crew have been able to go back on board. What sort of financial assistance can they get from the company?
I can completely understand why the crew are asking this question. A lot of them have been at home for more than a year now. And I completely understand the pain that people are going through. Our focus at the moment is to get people vaccinated, get them on board our ships as soon as possible. And this is the way that the company wants to support the crew and their families. Now, we make sure that we get them the joining dates ASAP, make sure that the travel to the ships is in a very, very safe environment, and then they can go on board, start their employment, and then continue to support their families back home. So that's what I have to say. But I just want to take the opportunity, Rakesh, you mentioned this is the last question, so I just want to take the opportunity to brief all the crew who have logged in that the company is taking up different initiatives to facilitate vaccinations for our crew. So I just want to very quickly brief on what exactly they can expect in the near future. So obviously the state government and the central government centers are open to all. You can book your appointments or do a walk-in and get yourself vaccinated. You can also go and visit a private hospital, an accredited hospital, which is a vaccinating center. And if required, if you pay for it, and we will, as Etna mentioned, keep those receipts with you, and you can claim a refund, an expense claim when you go back on board. There are a couple of other things that we are working on. One is we are trying to tie up and have a partnership with different private hospitals where they give us dedicated slots for our crew members. So they will say that, I give you X number of slots so many times a week for vaccinating our crew. And then the team will then approach our crew members who are living in that vicinity and ask them to book their appointments. We will facilitate booking the appointments as well. The other thing is, some of you may already know that the Director General of Shipping has started an initiative supporting the vaccination process. So the Director General of Shipping is now partnering with 3 port hospitals, the one in Mumbai, Kochi, and Calcutta. So seafarers can go to these hospitals through a process. So the manning agencies, the crewing agencies like ours, CSSI, we will be applying for an appointment, a vaccination for our crew through the DG portal. And once we have confirmed availability of the vaccine at a particular hospital, the system itself will intimate the crew member that this is a appointment which has been secured for you, and then our crew members can visit these hospitals and get themselves vaccinated. And there is one more initiative that we have taken. We are exploring possibilities of partnering with third parties, service providers, where they have a tie-up with multiple hospitals across India. And similar to what I just mentioned about spots, dedicated appointment slots available, this company will support us, facilitate getting appointments in multiple hospitals across India. So all these are in a very advanced stage of progress, negotiations, and everything. So please watch this space. We will communicate with all our crew. Our focus is to make sure that all the crew who are on leave are safe, they get vaccinated. But as everybody in the panel said, in the meantime, and even after you get vaccinated, please follow the COVID norms. Please, the key word is hands, face, space. Wash your hands, sanitize your hands, cover your face with a good mask, and then maintain the distance, the social distance. Okay. So I also want to thank everybody who's taken time to come on and log in and be part of this webinar. Thank you so much. Over to you, Rakesh.
Thank you, Prasad. That's very insightful. And very quickly, I just want to clarify the DG Shipping partnering with the 3 hospitals. And when you say that CSSI can apply for them, is there a category? Do they need to have a joining date, or they can join? They can go and we can apply for them without a joining date?
No, the condition is that we must have a joining date for the seafarers. Thanks for asking me that question. We must have an appointment for a ship appointment for every seafarer that we request and vaccination for. And that's something which is a field that we need to key in at the time of applying to the DG. Now, the DG came on a webinar and said that this is something that is mandatory at the moment, but depending upon availability of the vaccine, they will review what exactly we can do.
Thank you, Prasad. Thank you so much. So I now ask Etna, in closing, is there anything that you would like to address to the group?
I just wanted to again thank everybody for taking the time to join us today. We know not everybody will have been able to join, so we will look to follow up with some FAQs to be able to support everybody at home. We are looking forward to seeing as many of you as we can back on board the ships across the fleet. And, you know, please keep yourselves safe, get yourselves vaccinated. And, you know, we want to look after you all. We want to look after each other. So please keep yourself safe, keep your loved ones safe, and get yourselves vaccinated at the earliest opportunity. We're working so hard to try and get every opportunity that we can to help you to do that. So please make every effort yourselves as well.
Thank you, Etna. Dr. Rashna, is there anything that you would like to say before we close?
I would repeat myself when I say that vaccinated or not, take the 3 precautions of wearing the mask, keeping your hands sanitized, and keeping a safe distance of 2 meters. And if you get the opportunity to be vaccinated, please do not miss it.
Thank you, Dr. Rashna. Dr. Brenda, over to you. Final words.
Thank you, Rakesh. Yes, maybe just, you know, to remember we're all in this together. We're all in the same pandemic. And to remind everyone that a pandemic is an illness that affects a whole community. And in this case, really widespread communities, countries, whole cities. And if we can think about the city or the community as having the disease, we all have a part to play in combating that disease. And so hopefully if you have personal reservations about getting the vaccine or beliefs, please think about the communities that you're living in and how you getting a vaccine will benefit everyone around you and not only yourself. So the only way we can actually get through this pandemic is through vaccines. And the reason why I say that is because there's no cure today for COVID. We've got great hospitals, we've got great doctors, we've got that we can give people who get COVID, but there's still people today that are dying from COVID where there's really nothing we can do for them. And what we need to focus on is every single way possible to prevent people getting COVID. And so if I can just encourage you, if you do, and when you do have access to a vaccine in your country, please get it. If you have access to a vaccine that we might offer you on board the ship, please participate and advocate for vaccines, talk about your vaccine experience, and let other people know the benefits and how good you feel and what a positive deed you've done by getting vaccinated. I've received my vaccine. I had some side effects from it. I was quite pleased about that, to be honest, because I felt like it's working and my body's getting ready in case I get exposed to COVID. And so I was very thankful for that opportunity. And I would just encourage all of you, if you have questions, speak to people that have access to the right information. We have provided information in letters to you of sites that we would recommend are trustworthy and give you the most current and up-to-date information. And whatever else you read, if I can just implore on you or ask you, please read the information on those sites that we're sending to you, because that is the scientific community, medical experts around the world getting together and agreeing on what is the best steps to take to combat the pandemic. So thanks again for the opportunity, Rakesh, and thanks to all of you waiting patiently or doing your best to comply with what we need as a company for you to be able to return to our ships.
Thank you so much, Dr. Brenda. And thanks to all our panelists for taking time off and speaking to our crew. And for our crew, thank you very much for joining in, and hope to see you soon. Thank you so much. Bye.
Take care, everybody. Thank you. Bye-bye.
Thank you. Bye-bye.